Hello there, my name is Dr. Erick Fuentes. I'm a breast endocrine and general surgeon working out of Sydney in Australia. One of my specialty interests is breast reduction surgery, and we're going to talk a little bit about what that means. So who has or goes on to have breast reduction surgery? Breast reduction surgery is usually recommended for women with macromastia. Now, macromastia is a medical term used to describe very large breasts, and the consequences of having large breasts, as a lot of the viewers might already know, is that it can cause a whole bunch of health issues, namely the sensation of heaviness or being pulled forward, but more so recurrent back and neck pain because of the weight of the breast pulling on the shoulders and on the neck. This can lead to grooving of the bra strap over the shoulders that can over time become permanent or a permanent mark over the skin and the shoulder muscles. A lot of patients have difficulties finding well-fitted bras or even clothes that they can wear, and it can often impair them in with their function, especially when they're trying to exercise. Now, a question that I usually get asked by patients is when is the best time to have breast reduction surgery? In an ideal world, that would be when the body is not undergoing any significant changes in body shape or size. Patients who are seeking to lose weight either by the use of medications such as Ozempic or by weight reduction surgery should probably wait until they reach a steady state in terms of their body shape and size. Unfortunately, though, the breast size can sometimes be quite large, even at a younger age. Another time that I tend to say to patients, maybe perhaps it's better to wait for the surgery is if they're tending to have children and breastfeed, as this will also change the quality of the breast tissue and the fatty layer within the breast tissue as well. However, sometimes it is not always possible. I have seen some very young patients with large breasts that impair their ability to do exercise or even cause significant issues with self-esteem and sexual well-being. And one of the things that I often find with breast reduction patients is that they have often sought chiropractors, physiotherapists, and all sorts of other treatments to treat their back pain, when a simple operation can relieve a lot of that and save them a lot of money in the long term. Now, breast reduction surgery is done in multiple different ways. There are many ways of performing the operation. The way that I do it is through what's called a Weiss pattern scar, also known as the lollipop scar, which looks like an upside down, like an anchor, really. The operation, depending on the size of the breast, will take anywhere between 2.5 to 3 hours. And I tend to keep the patients overnight for safety and to make sure that they get adequate pain relief before they go home. In terms of recovery, most patients find that post-surgery they have swelling of the breast that lasts for about 6 to 8 weeks following surgery, and this is quite normal. This is a normal process of acute inflammation and change associated with it. During this time, patients find that they find it difficult to lie on their side because of ongoing pain, and I do recommend that they wear a sports bra throughout this recovery period. Some of the common complications, not really complications per se, but they are sequelae of the surgery, or what we call cosmetic sequelae. By that I mean, things such as a slight difference in the size of one breast versus the other. Keeping in mind that in most women, they don't have exactly symmetrical breasts. We have a saying in breast surgery: the breasts are sisters, not twins. There may be subtle differences in the position of the nipple areola, and another common thing which is difficult to predict who gets is scarring. So scarring on the skin surface called hypertrophic scarring, which are thick, itchy scars that can last for about 2 years following surgery. and also the occasional person who gets keloid scars. And this is a little bit more predictable. It is often we find in patients of darker skin tones from Southeast Asia, Africa, and the Middle East. Another question I often get asked is, what size is it going to be? I never say you're going to end up with a specific brass size or cup size, because even the bras are not designed in a standardized fashion. So one person's B cup is another person's C or D cup. But I do say that I can give you an estimate of how the distance between the fold of the breast on the skin to the nipple, and that will give you a bit of a rough guide as to what size that will be. But as a general rule of thumb, it's about a C to a double D cup at the end of the whole process. Some of the risks involved with this operation, obviously the risk of general anesthetic, post-operative bleeding, wound infection, and sometimes at some of the corners of the scars you can get a small amount of wound breakdown. More significant risks associated with this surgery is partial or complete nipple necrosis, where the blood supply to the nipple is impaired, and as a consequence there's a loss of the viability of the skin to that nipple. Another more common complication, which we often see in patients with a fattier breast, is this process called fat necrosis, where by the same process of poor blood supply to a particular area of the breast that remains, the fat or the fatty tissue tends to die and become quite lumpy, or it can lead to a contour abnormality. That said, it is uncommon, or if it is, if we do see it, often see it on mammogram a few years down the track, and most patients tolerate the procedure quite well. And I think they're usually some of my most grateful patients, because they've lived with a burden of heavy chest, impairing their neck and causing a whole bunch of problems.